Good morning, classmates. Good morning, Sir Kerwin Reyes. Today, I will report about the mini case study. The topic is one of the nutritional disorders, and we choose iron deficiency. This is the table of contents. If you want to review the slides of our report, and I also included the glossary. This is about the words that new to you, and you want to know the meaning, you can search it here. Okay, to start with, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, according to the World Health Organization. This means that health is a resource to support an individual's function in wider society rather than an end in itself. A healthful lifestyle provides the means to lead a full life with meaning and purpose. The best way to maintain health is to preserve it through a healthful lifestyle rather than waiting until sickness or infirmity to address health problems. People use the name wellness to describe this continuous state of enhanced well-being. Iron deficiency is a nutritional disorder. Iron deficiency anemia, or IDA, is the most common type of anemia. It happens when you do not have enough iron in your body. Iron deficiency is usually due to blood loss, but may occasionally be due to absorption of iron. But how can we battle ourselves to avoid from getting sick? Can we make our body healthy and free from any diseases? What will you do to prevent infections that cause sickness in our body? Let's find out how we can treat an illness that will envelop our body. Objectives. Iron deficiency is due to insufficient iron. Without enough iron, your body cannot produce enough of a substance in red blood cells that enables them to carry oxygen, which is called hemoglobin. As a result, iron deficiency anemia may leave you tired and short of breath. Classification of iron deficiency. Anemia can be classified as microcytic, normocytic, or macrocytic depending on mean corpuscular volume. As stated above, it can be hyporegenerative, or disorders of erythroid proliferation or maturation of red blood cells, or regenerative, which is this type of anemia is destruction of red blood cells, or hemorrhage, which depends on the number of reticulocytes, means immature red blood cells. So these were the 10 signs of having iron deficiency. So you may feel fatigue, difficulty focusing, crazy, sore muscles, apathy, brittle nails, unusually pale skin, pink or red urine, frequent infections, trouble doing your normal workouts, and breathlessness. What causes iron deficiency? The most common cause of anemia is low levels of iron in the body. This type of anemia is called iron deficiency anemia. Your body needs a certain amount of iron to make hemoglobin, the substance that moves oxygen throughout your body. However, iron deficiency anemia is just one type. Other types are caused by diets lacking in vitamin B12, or you cannot use or absorb vitamin B12 like pernicious anemia. Diets lacking in folic acid, also called folate, or your body cannot use folic acid correctly, like folate deficiency anemia. Third, inherited blood disorders like sickle cell anemia or thalassemia. Fourth, conditions that cause red blood cells to break down too fast. Example is hemolytic anemia. Fifth, chronic conditions causing your body to not have enough hormones to create red blood cells. This include hyperthyroidism, hypothyroidism, advanced kidney disease, lupus, and other long-term diseases. Sixth, blood loss related to other conditions such as ulcers, hemorrhoids, or gastritis. Seventh, iron deficiency anemia is diagnosed by blood tests that should include a complete blood count or CBC. Additional tests may be ordered to evaluate the levels of serum ferritin, iron, and total iron binding capacity and transferrin. Then these are the two types of iron absorption. So we do have heme iron or non-heme iron. So these are the foods under heme iron. So these are animal-based, and the non-heme iron are plant-based. So heme iron from hemoglobin in meat and fish in the reduced ferrous form, highly absorbable. The food is highly absorbable. So in the stomach, heme containing iron in ferrous form is hydrolyzed from protein globin component. And then in the intestine, the ferrous remains soluble as it is bound to proteins and is absorbed through enterocytes. Then the non-heme iron from plants in the oxidized ferric form is less absorbable compared to heme iron. In the stomach, some ferric reduce to ferrous in acid conditions of the stomach. Then in the intestines, some ferric forms insoluble complexes at high pH of small intestine, lowering absorption rates and increasing excretion. How is iron deficiency treated? Even if the cause of the iron deficiency can be identified and treated, it is still usually necessary to take medicinal iron, more iron than a multivitamin can provide, until the deficiency is corrected and the body's iron stores are replenished. In some cases, if the cause cannot be identified or corrected, the patient may have to receive supplemental iron on an ongoing basis. There are several ways to increase iron intake. Example with the diet: meat, beef, pork, lamb, especially organ meats such as liver, and next poultry, chicken, turkey, duck, especially liver and dark meat, fish, especially shellfish, sardines, and anchovies. Fourth, leafy green members of the cabbage family, including broccoli, kale, turnip greens, and collard greens. Next, legumes including lima beans, peas, pinto beans, and black-eyed peas. The next, iron-enriched pastas, grains, rice, and cereals. Prevention: eating a well-balanced diet that includes iron-rich foods may help you prevent iron deficiency anemia. Taking iron supplements may lower your risk for the condition if you are not able to get enough iron from food. Large amounts of iron can be harmful, so take iron supplements only as your doctor prescribed. this is the anatomy and physiology. So these are the symptoms of iron deficiency. So your eyes will be yellowish, and then your skin is pale, cold, and yellowish. And then with the respiratory, you will experience shortness of breath. You will also experience muscle weakness, and then there is a change in stool color in terms of intestinal. Then you will also feel fatigue, dizziness, and then if it is severe anemia, there is a tendency that you will be faint, and then you will have low blood pressure and then you will also have palpitations and also tachycardia or rapid heart rate. And then if severe anemia, you will have chest pain, angina, and heart attack. And then you may also experience an enlargement in your spleen. So iron deficiency, this is the most common type of anemia overall, and it has many causes. Iron is an essential part of hemoglobin, and low iron levels result in decreased incorporation of hemoglobin into red blood cells. It is due to insufficient dietary intake or absorption of iron to meet the body's needs. Infants, toddlers, and pregnant women have higher than average needs. Increased iron intake is also needed to offset blood losses due to digestive tract issues, frequent blood donations, or heavy menstrual periods. The most common cause of iron deficiency is bleeding or blood loss, usually from the gastrointestinal tract. Worldwide, the most common cause of iron deficiency anemia is parasitic infestation, such as hookworm, amoebiasis, schistosomiasis, and whipworm. How iron gets absorbed. So this is the schematic diagram. Okay, so there are two source how to get iron. So we can get iron through plants, meats, and then ferrous sources. We can then on the other side, we can also get iron from food supplements like ferrous, ferric, larger complexes, and heme, and other elemental of iron. So the first step is through the stomach. This is for the iron to be released from whatever it is bound to and made soluble. Soluble means can dissolve by the water. This is mainly done in the stomach through gastric acid, enzymes, and churning action. And then on the other side of elemental iron needs to be converted to ferrous before it can be absorbed. And then ferric and ferrous iron readily convert depending on the conditions. So this is the elemental iron, this is the ferrous iron, ferric iron, and these are the larger complexes, and this is heme iron, so more soluble and quicker. And then through the intestines, the most iron absorption happens through specific cells that line the upper part of the small intestines. So the enhancers, such as vitamin C, form complexes with iron which help it in. Then on the other side, the food supplements, the larger complexes generally release their iron in the intestines, and ferritin is one of the few that can get absorbed whole. This is a schematic diagram. It will be explained by Ms. Dimaano regarding this schematic diagram of iron deficiency. So next, then nursing care plan. Patient's name is Ni Wang. Age, gender 30, female. Date of admission and time January 20, 2021, 7 a.m. Female ward. Assessment. Subjective. Madaling mapagod ang aking katawan as verbalized by the patient. Objective. Blood pressure 110/70 mmHg millimeter of mercury. Temperature 36.5 degrees Celsius. Pulse rate 80 beats per minute. Respiration 15 cycles per minute. IVF plain NSS 1 liter at 120 cc per hour infused on right corpus at 32 to 33 drops per minute. Then complete blood count result: hemoglobin 90 grams per deciliter, which is low. Hematocrit 0.35, which is also low. Then low mean corpuscular volume 75, and then low mean corpuscular hemoglobin concentration 28 grams per deciliter. Then elevated platelet count greater than 450,000. Then elevated WBC or white blood cell count 15 by 10 raised to the power of 9 per liters. Then capillary refill test or CRT 2 to 3 seconds. Pale skin noted, weak looking, cold hands and feet noted. Fatigue, shortness of breath. Diagnosis: fatigue related to decreased hemoglobin and diminished oxygen carrying capacity of the blood. Planning: within 8 hours of nursing intervention, the patient will verbalize increase in energy and perform desired activities as evidenced by consuming iron-rich foods. Interventions with Rationale: first, establish rapport to gain patient's trust and cooperation. Second, vital signs taken and recorded to have a baseline data. Third, intravenous fluid checked and regulated to avoid complications. Fourth, monitored complete blood count result to monitor iron, hemoglobin, white blood cell, platelet level. And then fifth, assess patient's ability to perform normal tasks or activities of daily living. This influences choice of interventions or needed assistance. Sixth, encourage the patient to eat foods that are high in iron, such as spinach, legumes, liver, and other organ meats. This is to maintain body nutrition and energy. Seventh, encourage patient to eat more and to drink more water and fruit juices. This is to increase appetite and hydrated. 8. Administered medicines as prescribed to increase iron hemoglobin level. 9. Encourage patient to consume foods that are rich in vitamin C. This is to enhance absorption of iron-rich foods. 10th, provided a quiet atmosphere. This will enhance the patient's rest and to give comfort also. And then 11th, elevated head of the bed as tolerated, enhances lung expansion to maximize oxygenation for cellular uptake. Evaluation. After 8 hours of shift, the patient was able to consume iron-rich foods. Therefore, it is goal partially met. Drug study. Generic name ferrous gluconate, brand name Sangobion. Classification vitamins and minerals. This is also recommended for pre and postnatal and also for anti-anemics. Dosages: Sangobion iron plus take 1 to 2 cups daily. Sangobion kids, prophylaxis of iron and vitamin B deficiencies, 5 ml daily. Treatment of iron deficiency, 15 to 30 ml daily. Then the daily dose may vary depending on the severity of iron deficiency and on the age of the anemic child. Sangobion baby child more than 1 year old take 1.2 ml. If more than. And then 6 to 12 months take 1 ml daily. Then if less than 6 months, it depends on the prescription of the doctor. Usually it should be taken once a day. So indications: Sangobion iron plus for iron deficiency anemia and anemia during pregnancy, growth, old age, and convalescence, megaloblastic anemia and macrocytic hyperchromic anemia, alimentary anemia. Prophylaxis against anemia in blood donors. Sangobion kids, iron deficiency anemia in children, latent insufficiency of iron and vitamin B, supplementation during chronic illness and convalescence. Sangobion baby, iron and folic acid supplements for anemia during growth period. Contraindications: hypersensitivity to this medicine, and then patients receiving repeated blood transfusions or suffering from anemia not caused by iron deficiency. And then adverse reactions: gastrointestinal irritation such as abdominal pain or cramps, nausea, vomiting, diarrhea or constipation, black stool, dark or green tarry stool, raspy aftertaste, pruritus or itchiness, urticaria or hives, difficulty of breathing or chest pain. Interactions: decreased antibiotic action of tetracyclines and quinolones, decreased absorption of levodopa, levothyroxine, biphosphonates, methyl-dopa, penicillamine, reduced iron absorption with antacids and proton pump inhibitor. Some food like tea, coffee, whole grain, cereals, eggs, and milk, oral neomycin, calcium, zinc, and oral magnesium salts, bicarbonates, carbonates, oxalates, and phosphates. Nursing interventions: assess patients' ability to perform normal tasks or activities of daily living. Note changes in balance or gait disturbance or muscle weakness. Recommend quiet atmosphere, bed rest if indicated. Elevate the head of the bed as tolerated. Provide or recommend assistance with activities or ambulation as necessary, allowing patient to do as much as possible. So the ferrous gluconate is the main component of Sangobion. It is organic and is less irritating to the gastrointestinal system than ferrous sulfate. Ferrous gluconate is the most easily absorbed of all ferrous salts. It is more than just iron. It is also contains folic acid, vitamin B complex, vitamin C, and minerals, making it a complete hematinic. Medication: the doctor prescribes to take sangobion once a day for 30 days. It can be taken with or without meals. Sangobion combines 7 important elements in one capsule, helps to replenish iron stores, and increases red blood cell levels in the body. Sangobion fights the symptoms of anemia such as fatigue, paleness, weakness, unable to concentrate, and dizziness. With this well-balanced and non-constipating iron supplement, you can look and perform at your best every day. It comes in an easy-to-swallow vanilla-scented capsule that leaves no metallic aftertaste. So, ferrous gluconate 250 milligrams, folic acid 1 milligram, vitamin B12 7.5 microgram, vitamin C 50 milligrams, sorbitol 25 milligram, manganese sulfate 0.2 milligram, copper sulfate 0.2 milligram. So dosage 1 to 2 capsules a day with or after meals. So 5 laboratory tests. Complete blood count. It is to check to see how many red blood cells. So on the this is what I search. A sample complete blood count with differential, because I choose this because it has male and female normal range. Okay, so going back, hemoglobin. This is the test to shows the amount of this protein in your blood. If you have anemia, your hemoglobin will be low. So it is what gives red blood cells their color. Hematocrit test shows how much of your blood is made up of red cells. Mean corpuscular volume is the average size of red blood cells or erythrocytes in a blood sample. Mean corpuscular hemoglobin is the average mass of hemoglobin per red blood cell in a sample of blood. Next, mean corpuscular hemoglobin concentration is a lab value found on a complete blood count that describes the average concentration of hemoglobin in a given volume of red blood cells. Next, white blood cell count, representing cells that protect the body from infection. It is usually normal or slightly low. But if there is infection, mostly it is high. Then, white blood cell differential identifies and counts the number of the 5 types of white blood cells present: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. The individual count can be reported as an absolute count and or as a percentage of total. Platelets, responsible for assisting in blood clotting, may increase initially in iron deficiency but often drop in number as the anemia becomes more severe. Second blood test, peripheral blood smear. This is to looking at the size and shape of red blood cells. So in iron deficiency anemia, red blood cells are smaller than usual. And then on this part, it is divided into three. It can be classified, classified as either schistocytes, microspherocytes, and sickled red cells. Third blood test: serum iron, total iron binding capacity, and serum ferritin. So serum iron, it measures iron levels in serum, represents iron that is almost completely bound to transferrin. Then total iron binding capacity measures the transferrin capacity to bind iron. Next, serum ferritin measures the body's ability to store iron. Last one, transferrin, measures levels of the iron carrier. Fourth, urinalysis. If a freshly obtained urine specimen appears bloody but contains no red blood cells, suspect hemoglobinuria or blood in the urine. Obtain confirmation in the laboratory that the pigment is hemoglobin and not myoglobin. This can be accomplished easily because 60% ammonium sulfate precipitates hemoglobin but not myoglobin. A positive region strip or dipstick in the absence of RBCs indicates the presence of hemoglobin or myoglobin. Hemoglobinuria occurs with hemolysis. It may occur in hemolytic anemias, hemolytic uremic syndrome, mismatch transfusions, freshwater drowning, septicemia, and paroxysmal nocturnal hemoglobinuria. It is also associated with carbon monoxide, fava beans, venoms, mushrooms, naphthalene, quinine, and many other substances. A CBC with smear will often show fragmented cells, and the reticulocyte count may be elevated. Myoglobinuria occurs with rhabdomyolysis after viral myositis and in children with inborn errors of energy metabolism, often after exercise. The clinical picture, as well as elevated muscle enzyme levels, may aid in distinguishing myoglobinuria from hematuria. So hematuria is blood in the urine, and then hemoglobinuria is hemoglobin in the urine. Okay, so if needed, hemoglobin and myoglobin may be measured in the urine. So, a urinalysis is used to detect and manage a wide range of disorders, such as urinary tract infections, kidney disease, and diabetes. A urinalysis involves checking the appearance, concentration, and content of urine. Abnormal urinalysis results may point to a disease or illness. Normal values as follows. Its color is yellow, light pale to dark or deep amber. The clarity, turbidity, clear or cloudy. pH 4.5 to 8. Specific gravity 1.005 to 1.025. Glucose less than or equal to 130 milligrams per deciliter. Then ketones, none, nitrites negative, leukocyte esterase negative. Last one, fecal occult blood test. A negative fecal occult blood test means no blood was detected in the stool at the time of the test. But a positive result indicates abnormal bleeding in the lower digestive tract, While this bleeding could be caused by colon cancer, other possible causes include ulcers, polyps, or hemorrhoids. For occult blood and hookworms infestation, if positive, the patient will undergo endoscopy or colonoscopy. Normal interpretation: the stool appears brown, soft, and well-formed in consistency. The stool doesn't contain blood, mucus, pus, undigested meat fibers, harmful bacteria, viruses, fungi, or parasites. The stool is shaped like a tube. The pH of the stool is 7.0 to 7.5. So these are the members. We are 19 in members. The list of the members is based from the file of Mr. Ezra de la Cruz, the one who sent the final output last week. Okay, so that's all. Thank you so much and have a great day. Bye.